Hey everyone, welcome back to the channel. Today we're diving into Cosentyx, also known as secukinumab, a powerful biologic that's changing the game for people living with autoimmune conditions like psoriasis, psoriatic arthritis, and ankylosing spondylitis. First, let's talk basics. Cosentyx is a biologic medication, meaning it's made from living cells and designed to target specific parts of your immune system. In this case, it blocks a protein called interleukin-17A, or IL-17A, one of the main culprits behind inflammation in several autoimmune diseases. So whether it's skin, joints, or spine, Cosentyx is approved to treat a range of conditions in both adults and children. Cosentyx is given as a subcutaneous injection, either with an auto-injector pen or pre-filled syringe. The typical schedule starts with weekly doses for the first 5 weeks, then continues monthly. If you're dealing with inflammatory spinal disease, including sacroiliac joint inflammation, Cosentyx stands out as one of the most effective and reliable treatment options available. Clinical studies show strong results in reducing spinal stiffness and inflammation. And here's the best part, Cosentyx is remarkably safe. Unlike many other biologics, it doesn't require regular blood tests to monitor liver, kidney, or blood counts. This makes it especially convenient for long-term use. Like all medications, Cosentyx can cause side effects. The most common ones include cold symptoms, headaches, fatigue, and upper respiratory infections. Still, for most people, side effects are mild, and again, the need for routine lab monitoring is very minimal. That's a major advantage compared to other medications used for autoimmune diseases. All right, clinicians, let's get into the science. Cosentyx works by binding to IL-17A, a pro-inflammatory cytokine central to the Th17 immune pathway. This dampens inflammation in skin, joints, and the axial skeleton. Dosing varies by condition and severity. For example, 300 mg weekly x5, then monthly, 150 to 300 mg monthly. Axial SFA and SI joint inflammation, 150 mg weekly x5, then monthly. Cosentyx has proven its strength in clinical trials. Over 75% of psoriasis patients reach PASI 75 by week 12. In psoriatic arthritis, ACR response rates are significantly better than placebo and hold up at 1 year. And when it comes to inflammatory spinal conditions like ankylosing spondylitis or non-radiographic axial spondyloarthritis, Cosentyx is often preferred because of its high efficacy and lower need for intensive lab monitoring. Before starting Cosentyx, you'll still need baseline screening for TB and hepatitis, but ongoing blood work isn't routinely required, which is a relief for many patients. As with many biologics, costs can be a barrier, but most insurance plans will cover Cosentyx after prior authorization, and the manufacturer offers support through the Cosentyx Connect program, which includes copay assistance and nurse support for self-injection training. To sum it up, Cosentyx is one of the best treatments for inflammatory spine disease and sacroiliac joint inflammation, offering powerful relief with minimal side effects and the convenience of no regular lab monitoring. Whether you're a patient or a healthcare provider, it's definitely worth considering as a top-tier therapy. If you found this video helpful, give it a like, subscribe for more medically accurate breakdowns, and drop your questions in the comments. I'd love to hear from you.